Hey everyone, and thanks for tuning in to a new episode of Beyond the Noise. We have officially passed the grim milestone of 12,000 reported cases of COVID-19 in Africa. Continent-wide, the coronavirus trajectory has been on a steady increase in the last few weeks. And as we speak, only the Comoros archipelago and Lesotho have been spared by the pandemic. Overall, governments have put in place measures ranging from local to national lockdowns, stay-at-home order or advisory, night curfews, and travel restrictions. But how effective are those measures? In the case of South Africa, which we already touched on last week, the response seems to be working. The country has recently seen its curve break sharply. It went from 243 new cases in one day to just 17. Since then, the daily average has settled at around 50 new cases every day. The situation is quite different in Niger, which is now the most affected country in the Sahel, with nearly 500 cases. I spoke to a Nigerian medical practitioner, healthcare activist, and founder of the NGO MedAfrica about the situation on the ground. Jamila Ferjani, who also happens to be my aunt, explained why the total confinement measure is counterproductive in the African context.
Le confinement est réaliste et réalisable dans les pays qui ont...
Expecting workers who have to come out to make a living and feed an entire family to stay confined in collective housing with a unique water point is difficult. It's difficult in those circumstances for people to practice social distancing and wash their hands regularly. I strongly believe that we should rather invest our time and resources in thorough awareness campaigns with messaging that should be relayed in all entities, be it civil society, religious councils, opposition parties, etc. We should utilize all media outlets such as television, community radio channels, and social media. Collective consciousness will emerge with time, and as people realize the seriousness of this crisis, ultimately it will happen.
Au fur et à mesure du nombre de cas, du nombre de décès, mais elle va finir par se faire.
This week, a few stories related to China were circulated on social media groups and networks in Africa. Some of them false and some true. So, did China supply 2 million infected masks to Africa, as claimed in a WhatsApp message that was widely shared in the last few days? Well, there is no evidence that the accusations are true, as explained by the fact-checking platform Dubawa, which notes that no source, specific manufacturer, or a destination country were specified in the message. Dubawa goes on to explain that while parts of the chain message are true, the author distorted the context. Findings show that in total, over 6 million masks have been shipped to several countries in Africa, and while there are reports of some returned medical masks, it was... Now, you may also have heard that a significant number of Africans in Gwangju have reportedly been subjected to forced evictions, arbitrary quarantines, and mass coronavirus testing as the country steps up its fight against imported infections. The story, which was relayed by CNN, Al Jazeera, RFI, and the BBC, amongst others, is founded on first-hand testimonies from African residents in southern China's largest city. You may wonder what sparked all of this in the first place. Well, China says that a recent cluster of cases linked to the Nigerian community in Guangzhou sparked the alleged discrimination by locals and virus prevention officials. Following the reports, the African Union Commission chairperson tweeted that his office had summoned the Chinese envoy to the AU over the recent reports. On our interview segment this week, we passed the mic to Aissata Lam, a women's rights activist and the president of the Youth Chamber of Commerce of Mauritania. The young woman, who recently contributed to an op-ed looking at the gender inequality factor in the coronavirus crisis, told us why women are particularly vulnerable in this moment. Take a look.
Over the past years, data has shown that in this situation, from health to economic security, from social protection to physical security, the impacts are always different for women and girls. And for COVID-19, there is no exception. We all know that at the front line of the response to this pandemic, the majority is women, nurses, technicians, the cleaners in the hospital, the professionals in the elderly centers, medical doctors. So the states, the governments really need to make sure that the protection given to them is adequate. The economic impacts, for example, are felt differently. Women earn less, they save less, and usually they have more precarious jobs. This takes me to my third point, gender-based violence. It's just crazy that you think that when the whole world is battling a virus, a pandemic, those crazy people will stay put, pause their crazy activities, but it's actually the opposite. They take advantage of the lockdown, they take advantage of the curfews in many countries to go and murder women, rape women, and at the same time, the state's services that are supposed to protect those women are not, fully functional. When we talk about a gendered response, we talk about taking all those elements into consideration.
Aïssa Talam also explained why this diagnostic also applies to the continent.
When discussing this gender perspective on the African continent, the rationale makes even more sense for all the elements that I mentioned previously. Social services are less financed and equipped. I think that the two elements that we'll also add on will be education and unpaid care work. For unpaid care work, it's generally disproportionately allocated, and we know that, it's a fact. But it's also increased with this quarantine and then confinement measures taken everywhere. Hence, with children out of school, sometimes increased care needs for the elderly who are more at risk, the women household chores increase as a matter of fact. This crisis is also greatly impacting the education systems, with all the negative impacts on the economic power of vulnerable households. We are very worried that young girls are more at risk of being withdrawn from school for financial reasons when, this comes back to normal.
Lastly, we asked Ms. Lam to give us her impressions of the Mauritanian response and what she thinks still needs to be done to support populations through this crisis.
As an African, I am very happy to see that our heads of states took early measures to prevent and limit the spread of the virus. As a Mauritanian, I was also very proud of my government. I am currently in Nouakchott, so I was able to really witness the measures taken by President Ghazouani, closing the airport and putting in quarantine all the passengers, including those at the borders. And since last week, all the people are tested before being released from quarantine. A curfew is in place from 6 p.m. to 6 a.m. The government put in place a special fund where our private sector also was able to contribute very largely. I was very proud to see the sense of patriotism and generosity of all the actors in order to help the government in its effort. A cash transfer program was also initiated for 30,000 households, specifically targeting women heads of households. So I was happy to see that gender approach. It's our role as individuals, civil society, private sector to also contribute to this global effort. We all have a role to play.
Well, that's all for this week. Stay tuned and follow me on social media. And if you must go out, wear a mask and support an African business in the process, like I did.